My SRC, my pride. A pleasure welcome to one and all watching this video. This is Jayapriya, working as Assistant Professor in PG and Research Department of Chemistry, Sithalakshmi Ramasamy College. In this video, we are going to see about classification of drugs based on their biological activity. Let us go for the video. First of all, we are going to see a definition about a drug. A drug is defined as any substance used for diagnosis, prevent, relief or cure of a disease in a man. So drug is a chemical substance which is used to find out a disease or to prevent a disease or to find a relief for a disease. The science which deals with the drug is called a pharmacology. So the science in which we are going to the study about a drugs, mechanism of drugs, administration of drugs, we are calling it as a pharmacology. Based on the biological effect, the drug can be broadly classified into four categories. The first one is the drug acting on CNS. CNS is nothing but central nervous system. All the types of anesthesia are comes under the CNS system. Next one is the chemotherapeutic drugs. So these drugs are used to treat a disease in a human body. So those drugs are called as a chemotherapeutic drugs. And then pharmacodynamic agents. They are nothing but drugs used to treat the normal regulatory process like a circulatory system, etc. And last one is the metabolic disease and the endocrine functions. So these drugs are used to treat the metabolic disorders. Drugs acting on CNS. These drugs act on the CNS of a human body, which consists of spinal cord and the brain. So CNS means spinal cord and the brain of a human body. If we have any defects or any disease regarding that spinal cord and brain, we can administer these types of drugs. It regulates special functions like circulation, digestion and respiration. If a person has any problem in a respiration or in a digestion or in a circulation of blood, these types of drugs are administered. The CNS drug can be further classified into following groups. First one is a non-selective CNS depressant. These group of drugs acts on the whole body. Next one is the selective modifiers of CNS. So these drugs act on a specific area, localized area of a human body. CNS stimulants are nothing but which stimulates the central nervous system. And the last one is the drugs acting on peripheral nervous system. So other than CNS are called as peripheral nervous system. The drugs which act on a peripheral nervous system comes under the fourth category. So chemotherapeutic drugs, use of chemical compounds in the treatment of infectious disease. So person is getting infected by some type of disease. This type of diseases can be treated using a variety of drugs. Those drugs are called as a chemotherapeutic drugs. Various drugs used in chemotherapy are known as a chemotherapeutic drugs. Chemotherapeutic drugs may be further subdivided into following types: antiviral agents, anti-leprosy agents, anti-neoplastic, antibiotics, antifungal agents, sulfonamides, antiprotozoal agents, organometallic compounds, antihelminthetics. So these classification is based on their root cause of the disease. So in this video, we are going to see in detail about the classification of these type of drugs. The first one is antiviral agents. So antiviral agents are the drugs used in the treatment of viral infection. For diseases caused by virus, so these types of drugs are administered. So an example for antiviral agent is methicillin. So what are all the diseases which are caused by virus? We can employ these types of antiviral agents. And the next one is anti-tuberculosis and anti-leprosy agents. So anti-tuberculosis drugs used in the treatment of tuberculosis infection. So mostly the tuberculosis infection is caused by a type of a bacteria. So we can employ the anti-tuberculosis drug to defect that bacteria and a person can overcome from that illness. Example for anti-tuberculosis drug is streptomycin. Next one is the anti-leprosy drugs. So anti-leprosy drugs are used in the treatment of leprosy. So leprosy is a type of a skin disease which is caused by a bacteria. So this to treat this disease we can employ anti-leprosy drugs. Example for anti-leprosy drug is diamino diphenyl thiourea. Next classification is the anti-cancer anti-neoplastics. So these types of drugs are commonly used in the treatment of malignant disease or cancer, are known as an anti-neoplastic agent or anti-cancer drugs. So these drugs are used in the treatment of uh, cancer, tumors and malignant tumors. So they are classified according to their mode of action. So how they are reacting on a human body, based on that we are classifying it into three: alkylating agent, antimetabolites and radioactive isotopes. Example for anti-alkylating agent: cyclophosphamide triethylene, and example for antimetabolites arabinoside, and example for radioactive isotope is radiophosphorus. So these are all the stages in which the anti-cancer drugs can be administered. Antibiotics. It can be classified as a chemical substance produced by microorganism having the property of inhibiting the growth or destroying the other microorganism in high dilution. So these antibiotics are nothing but some disease will be caused by a bacteria. So to stop by what? The bacteria enters the human being body, it replicates, it multiplies, which causes some disease. So initially we have to stop that growth of a microorganism, so especially the bacteria. If we stop the growth of the microorganism, that disease can be cured. So to stop the growth of a microorganism, we need one drug. That drug we are calling it as antibiotics. These are obtained from microorganisms in a high dilution point. For example, penicillin and chloramphenicol are the antibiotics. These are get from the bacteria. So in a high dilution, we are employing to cure a particular disease which is caused by a bacteria. It will cure. So those drugs are called as antibiotics. Next classification is antifungal and antibacterial agents. So in humans, some disease can be caused due to the fungi. So to treat those type of disease, we will employ antifungal agents. So antifungal agents used in the treatment of fungal infections. Some antifungal agents are applied in topically. So most of the antifungal agents we will apply as a lotion, ointment. We do not administer it into a oral part. Example of this type of antifungal agents are nystatin ointment, B lotion. Others can be used orally, and also example for a oral drugs are hemacin suspension, grisofulvin. Antibacterial agents are used for the treatment of bacterial infections. So bacterial infections we can treat it using the antibacterial agents. The example for antibacterial agents are tetracyclines and chloramphenicol. Sulfonamides. So sulfonamides are the antimicrobial synthetic compounds in which sulfonamide groups are present. So the drugs which have the sulfonamide groups comes under this classification. So the example for sulfonamide drug is sulfadiazine. Antiprotozoal agents. These drugs are used to treat the protozoan infection of human beings, including malaria ambiosis. So, protozoa is nothing but a parasite will be there. That parasite will go to some of the insects. That insect comes and bites the human being. We will get that disease. So, these type of disease carrying are called as protozoal infections. So the drugs which is used to treat the protozoal infections are called as the antiprotozoal agents. Some important antiprotozoal drugs are the urea, tibamine, isothianate, etc. Next one is the organometallic drugs. So drugs which contains any one of the metals such as arsenic, antimony, bismuth, Hg, gold is called as a organometallic drugs. The example for this types of drugs is given below. If it contains AS group drugs or arsenal, strovestrol, SB group drugs, tartarametic, stifoben, Hg group organometallic drugs or mercurial diuretics, mesali, AU containing organometallic drugs or crislogan, orotheoglucose, and the last one is bismuth containing organometallic drugs is neocardryl. And the last one is the antihelminthic agents. So antihelminthics are the drugs used to kill or remove the parasitic worms. The example for these types of drugs is chloroquine and piperacin. So finally, in this video, we have watched all the classifications of the drugs based on their biological activity. Thank you for your patience listening.